this is their daughter who just married one of our machinists. So this whole family really will have the ability to come to the clinic.
Lynette Kluver is the Director of Organizational Development at Alexandria Industries. It's been a dream of hers and others at the company to have their very own clinic. As she walks through the new family health and wellness clinic, she thinks back to how this all got started.
For about 10 years, we've been working with Achieve Wellness to understand what the risks and concerns of our employees based on biometrics, blood pressure, cholesterol, diabetes, those kinds of concerns. And we want to be innovative, we want to be creative as an organization, and so we started talking, what's the next thing we're going to do? And it was really a dream of ours about 2 years ago to say the next thing would really be to open our own clinic and to build off of that wellness program. And so this is really a dream come true.
CEO Tom Scheibel feels that the idea has merit on many levels. A healthier workforce, yes, but it's also a way to bring the company's hundreds of employees under their protective wing, like a family.
It's neat to save a couple dollars on an office call, but it's a whole lot neater when we know that we can care for our families the way we want to. And healthcare, some of those choices have been taken away because of insurance, because of how the whole economics work. But we get a chance to do it differently, and so for me that's been exciting.
Alexandria Industries owns the clinic and will make the services available to their employees at no cost. A third-party provider, Achieve Wellness, will actually staff and operate the clinic. A.J. Sherman is the organization's chief operating officer. He says this idea isn't just a convenience for employees and their families. This model of care could take away obstacles that stop people from seeking care.
It's a way for them to not have the cost obstacles. It's a way for them to have a high level of convenience for them. So those people that haven't been to the doctor in several years or more, this is an opportunity to engage them and do preventative checkups and really show them a side of healthcare that is maybe not as intimidating as they may have thought.
From personal experience, Scheibel was diagnosed with cancer a few years back, and he agrees the clinic's ease and availability could be a lifesaver.
A year and a half ago, I have my physical. My elevated PSA, but still okay. I wait 1 year for a physical. My PSA is off the charts. Oops. So what could we do different? We could have our employees come here if they've got a slightly elevated PSA and have it checked every 3 months. We could have a PSA week and have all the men from our facility come over and have their PSA checked. And maybe we could prevent 1, 2, 3, 5 people and get early detection on prostate cancer. That's what we can do that the normal environment doesn't allow for that to happen.
He is quick to add that Alexandria has excellent healthcare facilities already.
Our clinic is here to provide something for our employees. This is not a wedge in the medical community. We've got great physicians, great healthcare. I personally have experienced that over the last years, and so this is just a different way to provide services to our employees. And we want to work very closely with the healthcare community in Alexandria and the surrounding area.
I'm most excited about making a difference in the lives of our families, that they're going to have a different kind of health care. They're going to be able to build relationships with the providers. They're going to be able to come over here with concerns. And I think what we're going to be doing is we're going to be impacting their lives. We're going to prevent chronic diseases by getting involved early on and by understanding risks and doing something about it.
The clinic will be open 4 days a week with a nurse practitioner and an LPN on staff. In an effort to make this primary care facility feel more like home, family pictures line the hallways, along with other touches throughout. But most importantly, the staff will also be able to take more time with each visit to add another level of comfort. Although more advanced care will have to be referred elsewhere, the mission of providing basic health care with an emphasis on preventative care could be the ticket to healthier employees with a long, healthy life ahead of them. For Voice of Alexandria, I'm Joe Krakowski.